Assalamu alaikum. So today I'm going to discuss about the anatomy of radius and ulna of horse. The equine forelimb includes several bones, but our focus today is on the radius and ulna, which make up the forearm. These bones play a vital role in limb support and movement. So, further moving on to the general description of radius, the radius is the primary weight bearing bone of the forearm. It's a long, slightly curved bone that articulates proximally with the humerus at the elbow joint and distally with the carpal joints, enabling movement at the carpal joint. So, for the anatomical features of radius, anatomically, the radius has a distinct head and also some facets which articulates with the humerus. A triangular shaped body that supports muscle attachment and a broad distal end that participates in the formation of carpal joint. So, for the general description of ulna, the ulna in horses is largely fused with radius. Unlike in some other species, it does not reach the carpal joint. Despite its reduced role in weight bearing, it provides essential sites for muscle attachment and also it forms some sort of bony projection, which is known as styloid process in other species. So, for the anatomical features of ulna, we have olecranon tuber, a prominent form of projection at the point of elbow. The most recognizable part of the ulna is the olecranon process, which forms the point of the elbow and serves as a lever for the triceps brachii muscles. The body of the ulna narrows distally and becomes part of the radius as it fuses during development. The ulna has also some other projections. The most important one is enconeus process, semilunar notch, and also trochlear notch, which is pulley-like structure. The fusion of radius and ulna. In horses, the radius and ulna fuse during fetal development, eliminating significant forearm rotation. While this limits mobility, it enhances stability, a crucial adaptation for an animal that relies heavily on straight line speed and weight bearing support. So, from the picture, I'm further going to discuss about the radius and ulna of horse and their most prominent projections. So, in this picture, as shown very clearly, we have two views or two aspects. One is medial aspect and the other one is lateral aspect. So, we are going to discuss about the prominent projections on radius and ulna of horse. So, first of all, we have a very prominent projection on ulna, which is known as olecranon process or olecranon tuber. So, now the question arises, why is it called olecranon process or olecranon tuber? The answer is very simple, that it is known as olecranon process and olecranon tuber because it somehow forms an articulation with the olecranon fossa of humerus. After that, we have a very small projection which is known as enconeus process. Below enconeus process, we have semilunar notch, which is also called trochlear notch because it is pulley-like. After that, we have a very thick projection which is known as shaft of ulna. So, on the proximal extremity of radius, we have some sort of facets which form articulation with the condyles of humerus. After that, on the proximal extremity of radius and ulna, we will find the proximal interosseous spaces, which somehow separates radius and ulna from each other. And by these interosseous spaces, the interosseous ligaments pass through. After that, we have shaft of radius, which is slightly curved. After that, further moving on to the distal extremity of radius, we will find some sort of depressions or grooves from which extensor muscles pass through. And somehow in other species, we will also find the lateral and medial styloid process, which is not visible in horse because the fusion of radius and ulna of horse is very deep.